This is Dr. Cruz at Kentuckiana Integrative Medicine, and we're interviewing Greg Sanders. Greg, is it okay if we put this video on the internet and our website?
Absolutely.
So will you tell us what brought you to Kentuckiana Integrative Medicine?
Yes, sir. I had been dealing with blood pressure problems and different things. Had high triglycerides and cholesterol, and my body was just running rampant out of control. And the doctors I was working with were doing what they knew to do, but it wasn't helping. And they had put me on a fenofibrate and metformin to try to get my insulin resistance down. And the fenofibrate, after about 6 weeks, started hurting me tremendously bad. My whole body just ached constantly. And my doctor suggested that I might need to get a calcium score. I hadn't had one since like in 16. And at that time, I had a calcium score of 57. So I went down and had the scan run, and it was up to 330. That's about a 600% increase. So
can you explain what a calcium score is?
It's a CT scan of the heart. It shows calcification around the arteries of the heart. The problem is it can't show you if it's inside or outside the artery, but it is there and present. If it's outside, even the cardiology team tells me there's nothing to worry about. But if it's inside, then you're developing blockages. So I had started investigating an alternative to stents and bypass surgery back when I had my scan done in 15 or 16, whichever it was. And I had run across the possibility of IV chelation and how it showed a lot of promise, and there was a lot of research about it that was being put out, just wasn't in mainstream medicine. So when I had found that my calcium score had jumped the way it had, I got to looking, found you. Brian answered the phone, said, "Hey, we can see you tomorrow." So I drove up on Friday, and I visited with you. I did my first plaquex and chelation therapy. I didn't tell much of anybody about what I had going on at the time, but I had been off the fenofibrate for a little over 2 weeks, and my chest and back had subsided some. My hands that felt like they were swollen and exploding had subsided, but my legs hadn't quit hurting. And by the time I drove back home that Friday, my legs had quit hurting. And I thought that was just kind of really something to pay attention to. So I came back the next week, stayed 5 days. On day 3, I had clearer vision, no pain, felt young and happy. I walked 4.5 miles on Thursday on the walking bridge here, just something to get out and do since I was stuck here. And just kind of laid around on Friday, came back the next week. Tuesday and Thursday, I got 7.5 miles in each day. I've continually felt better. Pains are gone. I have no daily discomforts. My thought pattern is better. My vision has steadily continued to improve. It's like I'm looking at the world with a different set of eyes. It's just clear, comfortable. I'm just really amazed at what all has taken place for me. One of the biggest things is meeting other patients here and hearing their stories. And when I met Carl, and he told me about his heart attack and his bypass surgery, he got to telling me about how he had had a terrible pain in his neck for an awful long time. And after his bypass surgery, his neck didn't hurt anymore. And he said, "I realized my heart had been trying to talk to me for a long time." And that's when it dawned on me. I had been seeing a chiropractor for about 6 months straight for a pain in my neck and under my left shoulder blade. It would not go away. Maybe an adjustment would clear it up for a little while and then it'd come back. But ever since I've started this therapy, I've not had that problem. So to me, the discomfort in my chest, my breathing, my physical abilities, just to give you an example, this past week, when I went home on Friday, I started to work about 3 o'clock, worked till 10 o'clock on Friday night. I was back up and at work at about 5:30 Saturday morning. I worked till 1 a.m. Sunday. I went to bed, I got up at 5, I was back at work at 5:30, and I worked till 11 o'clock Sunday night. Then I got up and drove up here on Monday. And I have not been able to work like that in at least 6 years.
That's wonderful. So, tell the folks a little bit about your ability to walk. You were telling me it was how long for a mile versus now?
So I have an airplane, and at home our runway is just under a mile long. So I would go and I would walk at the airport, so I didn't have to be out in traffic. And about 2 miles had gotten to be about all I could stand to do, and it was taking me about 20 and a half to 21 minutes to walk a mile. The first day that I walked the 4.5 miles, I averaged 18 minutes and 20 seconds a mile. So my pace had increased, but not only that, I had been able to more than double what I had been doing. And this is a ramped bridge. The bridge is flat for half a mile, it's ramped down, so you have to climb a hill on both sides. My airport is flat. So I went from struggling to walk flat ground for 2 miles to enjoying a 4.5 mile stroll. And I didn't have to quit, I just did because I didn't want to be pushing myself too much.
Right.
And so that, among other things, has just dramatically increased.
And you're now even able to walk 7 miles, I think you said?
Yes, 7.5.
Okay.
That's I did that and just quit. I went late and it was getting dark, so I stopped.
Right.
But I could probably continue on. I have no issues until I get over 5 miles and I drop off about 30 seconds. I actually had my walking pace down. Earlier this week, I had walked at 17 minutes, 15 seconds.
That's awesome. And so your chest pain and neck pain are gone since you started
Yes.
chelation and plaquex.
Yes,
And did you tell me your love life is better?
way better,
And
Way better.
even your wife noticed that.
very much so.
That's great. So overall, and where do you come from to visit us?
I come all the way from just in North Mississippi in a little town called Baldwin, about 20 miles north of Tupelo. I drive 5.5 hours minimum one way to get up here, depending on traffic. But it's been worth every moment of it. I've been staying all week and doing therapies each day because I wanted to be able to knock this back and see if we could make some improvements quickly, because if not, then, maybe I had to go another route. But from the way that I feel, I don't believe I'll ever need another intervention. I think that I've chosen the right path.
That's wonderful. So it's a big effort from Tupelo, Mississippi. It's a 5-hour drive, you say?
Yes, 5.5, 6 hours, just depending on traffic.
And then Greg has to stay here for a week, but he's made steady progress each week. And typically, most folks with a calcium score like Greg end up doing 40 treatments. So he's trying to knock it out really quick in just a couple of months, and that's why he's treating every day. Local patients typically treat twice a week, but Greg's a very determined guy. And so tell the folks what you do at home that you work so darn hard.
Well, my wife and I own a transportation company, so we own trucks, we serve the flatbed industry, and we have maintenance issues, and it's constant communication and work and moving equipment around. So it takes a lot of demand, and thankfully they've been able to take care of it while I've been away, and God's blessed me with the opportunity to be able to come stay with you. It's given me a lot of opportunity to meet a lot of different people and see the benefits. And and now we know that I'm mercury and lead and thallium poison. So the chelation even means more to me now, since lead has an inherent ability to cause calcification and plaquing in the arteries. And meeting Cody, who was 25 years old, high school baseball pitcher, and mercury put him down. And thanks to you and your therapies here and your knowledge, and from August till now, Cody's walking in where he used to couldn't.
Right.
And that was out of his mouth. He told me a story. I thought, my gosh, man, you look so young and healthy. But and maybe at one time he was, but the mercury got him.
Yeah.
But to hear 5 other people that have talked to me about meeting Cody when he first started coming till now, they said he couldn't walk in here.
Yeah.
He was in terrible, and even Cody told me he was bedridden 15 to 16 hours a day.
Yeah. Yeah, elevated heavy metals, arsenic, lead, cadmium are really hard on our body, and they can knock you down for sure. And Dr. Gervasio Lamas, who you know well, the Harvard-trained cardiologist who proved that chelation could reverse heart disease, talks a lot about how toxic these metals are, and they're in the air, because of industry is putting that out there.
Yeah, our fuels pump it every day.
That's right. That's right.
And I have a background of many years in the chemical industry. I worked for a refining company. I've hauled chemicals for both DuPont and Ergon. And anyway, I've been in and out of some facilities that don't handle friendly stuff. So I guess that I may be part of the price that I'm paying for that.
Right.
We done our safety. We done what we thought we were supposed to do and what we were instructed, but apparently it had its effects anyway.
All right. Well, Greg, thank you so much for sharing all that. I think that's going to help a lot of people learn and be more open-minded about chelation. So we really appreciate you.
Yes, sir.